As you know, there's no discs at the C0, C1, and C1, C2 level. Because there's no discs, we have to have additional upper cervical ligamentous structure to lend stability to this region of the spine. If you have a patient with upper cervical discomfort, and there's a history of an accident or injury or some type of trauma to the head-neck region, or perhaps your patient has a condition such as rheumatoid arthritis, it's not a bad idea to look at the integrity of the upper cervical ligaments. Two very simple tests. The first is the Alar ligament, which is simply performed by grasping the bilateral lamina of C2 and very gently and carefully, passively, right side bending the upper cervical region. Based on ligamentous connections of the alar ligament, right side bending will tense the left alar ligament and cause an immediate right rotation of the C2 vertebrae. As the C2 vertebrae rotates to the right, its spinous process is going to immediately move to the left. And I'm feeling for that spinous process to move to the left into my thumb. So again, right side bending tenses the left alar ligament, causes an immediate right rotation of C2, and that spinous process will move to the left and push right into my thumb. Next, another important ligamentous structure is the transverse portion of the cruciate ligament. Okay? This holds C1 stable in relation to C2 in the sagittal plane. So we're going to have the patient perform active assisted upper cervical flexion. So just bring your chin down and in. You have the patient do as much of that movement as they can. Approach the patient from the front and the side. Stabilize the head. Bring your next hand in and gently palpate the bilateral lamina of C2. I'm on both sides of the C2 spinous process. Press through the skin, the subcutaneous tissue, and the muscular tissue until you feel, with the tips of your thumb and index finger, the bilateral lamina of 2. At that point, we press C2 forward in an anterior direction. Okay? And if there's good integrity of the transverse portion of the cruciate ligament, we should feel no anterior movement of the C2 vertebrae.